You're looking at Toronto's Hospital Row. Inside these buildings, thousands of COVID patients have been cared for. Some made it home, so many others haven't. Just meters away from where they died is Ontario's Queen's Park. This is where the province's public health announcements are made. And tonight we're exploring one core question. Are public institutions nimble enough to pivot quickly in the face of a future pandemic?
No longer can we as a society say we're going to transfer the risk of infectious disease onto local government officials.
In January 2020, Dr. Charity Dean was the Assistant Director of California's Department of Public Health.
I'm going to give you some numbers on how things have shifted.
Nearly 2 months before the COVID-19 outbreak was declared a pandemic, Dr. Dean was sounding the alarm in the most populous state in the USA. She was warning that exponential growth of the virus was already underway in the state, and it was going undetected, though her warning became entangled in the slow churning wheels of bureaucracy and public office.
I think it's really important in looking back on how the systems failed that we not blame people and that we look at what kind of systems were in place that enabled that to happen. What system solutions need to exist so that when this happens again, we are better prepared to detect it and contain it fast.
We have to rebuild the system.
As part of his years of research, Dr. Kerry Bowman has visited wet markets around the world. 1 year before the pandemic, he visited this market, which is linked to the first reported case of COVID-19.
When I was in the Wuhan market, I counted 57 species of animals, and more than almost 2/3 of those species were wild animals. They had high-powered hoses blasting urine and feces and blood all over the place. You couldn't do more to create lab conditions for, the potential for recombination of viruses and zoonotic outbreaks. And I was really amazed to see that, considering that SARS-1 emerged from China.
Dr. Bowman was exposed to SARS in 2003 while battling the infectious disease on the front lines in a Toronto hospital.
I myself was in the early days of this pandemic saying publicly that we've learned all sorts of lessons from SARS. What I didn't realize is we didn't actually implement any of these things, from PPE to allowing the people that were looking at global surveillance to speak freely. We really didn't do that.
Transferring the risk management of infectious disease to government and just assuming that government can come to save us, that didn't work. In other words, it has to be a whole of society response. We can no longer afford to move at the speed of fax machines. We now understand our entire economy depends on it. So standing up solutions has to involve innovative technology. It has to involve the private sector. It has to involve a type of biosecurity systems-wide approach so that everyone is part of it and no one is left out.
Recently, an independent inquiry recommended to the World Health Organization that they put together a global health council, though Dr. Dean is adamant that any council which is put together must include both the private sector and local medical officers of health who are working on the ground. I'm Adrian Ghobrial for City News.